Good morning, everyone. Thank you for joining us today. My name is Marta Fernández de Alarcón. I am the Secretary General of the Spanish Business Council, and I want to welcome you to this webinar about advancement in eye care, improved vision health in the UAE, led by Dr. Borja Salvador, consultant ophthalmologist at Barraquer Eye Hospital. As you may know, Barraquer Eye Hospital is one of the reference hospitals in the world in ophthalmology care, and what differentiates the hospital versus any other ophthalmic care in the region is the 80 years of heritage that it carries with it from Spain. Popularly known as Barraquer Ophthalmology Center in Barcelona, this is their international venture under Barraquer. So we are very pleased to come with them in the chamber. I am delighted to present today for this webinar. Our expert from Barraquer is Dr. Borja Salvador. I just want to say thank you for the collaboration and support, and always very, very active in the chamber. As you may know, the Spanish Business Council, it is an international community, and with all our members, we are creating an amazing platform to interact, to share ideas, to make businesses, and to find collaborations between all our members and all our community. So I don't want to waste time to our speaker. I give the floor to Borja. Thank you so much, and let's start. Thank you.
Thank you, Marta, for the kind invitation, and welcome everybody. I'm gonna today kind of like try to present us to all of you, for those of us who don't know us, and also to share a little some tips on the most common diseases or conditions that we see in the UAE and that we treat. And I think that the most interesting part would be at the end, if we have, I think we'll have some time to, if you have any questions, any comments, something that maybe you don't know about the eyes or so, and I will be more than happy to answer to all those questions. So I'm going to start sharing my presentation. I hope that you can see them well. So basically, I'm going to talk a little bit about the vision health in the UAE and also about Barraquer. These are kind of like topics that we will talk or discuss about today. So who are we? Like Marta very nicely stated, we are an institution from Spain, from Barcelona, with more than 80 years of experience and in eye care. And we have been treating in these 80 years patients from all over the world, including the GCC area, but also the US, MENA region, Asia, and obviously Spain and Europe. We have 4 generations of ophthalmologists. The first one was José Antonio Barraquer Roviralta in the late 19th century. Then his son Ignacio continued the tradition, and then late Professor Joaquín Barraquer, who I had the pleasure to meet and to be a resident during my training, and the current Professor Rafael Ignacio Barraquer, who's now the leader and the boss in Barcelona. But this is not the last generation. I'm happy to introduce Dr. Anton Barraquer Cargachin. He's the son of Rafael, and he's the 5th generation of ophthalmologists. So we are happy that the legacy and the tradition will preserve and endure under his leadership in the next few years. He finished the residency training. I don't know why this is happening. Anyway, he finished the residency training in Croatia, and because his mother is Croatian, so he speaks Croatian, and now he's been in Barcelona for the last couple of years. I'm going to give you a couple of tips or notes on the few achievements that Barraquer has achieved in the last 80 years. So José Antonio Barraquer was appointed the first professor in ophthalmology in Spain back in the late 19th century. His son, Ignacio, invented what we call the Erisifec, which is this machine that you see here. This is basically a vacuum machine that allowed us to remove the cataract back in those days, before the current technique was invented. So at that time, we had to remove the whole lens, the cataract. I will explain to you about it later. but in full. And if you try to do it with some forceps, the cataract will break, because you have to understand that the cataract is kind of like a lentil. So this vacuum machine was very useful for the manipulation and the removal of these cataracts easily without major complications. Then José Ignacio Barraquer Moner devised this refractive keratoplasty, which set up the baseline of what we currently or now these days do in laser refractive surgery. He was using these like knives to kind of mold the cornea, and all his studies and all his principles are now the ones that we use in laser refractive surgery for myopia, for hyperopia, or for astigmatism. Then Professor Joaquín Barraquer, among other things, he founded the Eye Bank for the treatment of blindness back in 1962, and this was the first in continental Europe. He also devised the microscope that we use these days with a slit lamp. The slit lamp is a machine or like a device that we use to, if you've been to the eye doctor, this is the machine where you put the chin there and we look at your eyes. So it's basically a lamp that has a very thin slit that we can modify as we want, and that allows us to kind of like make a kind of like a cut of the eye so we can see all the structures. So he implemented that in the microscopes to help with some surgeries, and he also added the videotape to record the surgeries, because since the eye is so small, it was not easy for the trainees to see. The last achievement, this was done, I think, like 10 years ago or less than 10 years ago. This is the implantation of the first bionic eye in Spain to give artificial sight. So this is the image of a real patient, the patient who was implanted with this chip on the retina for a condition that's called retinosis pigmentosa. And this patient, after this successful surgery done by Dr. Nadal, he could see, while before he could not see. So he could walk around safely thanks to this chip. But all these achievements cannot like overcome our motto. This is the motto that was implemented by Ignacio Barraquer, and we have been following this since the old times. And we try to treat the patient in the same way in which we would like to be treated. This has always been driven us in our profession in Barraquer, and this is what we are trying to bring here in the UAE for our patients in the area. So how do we do this? Basically, based on 4 pillars of the treatment. The first one is the actual treatment for our patients, the care of our patients. We do this through the hospital. This is an old picture of the hospital before the renovation was done. And I think it was in the 60s or 70s. It was only like 3 or 4 floors, and then we added a couple more floors to look like it looks the way that it looks today. So we have been treating patients for the last 80 plus years. We have been also doing a lot of training. We like teaching. We have residents every year that follow the Spanish program, and we currently have 5 per year. When I was doing the residency a few years ago, we were 4 per year. But now we have 5 per year. The training in Spain is 4 years, so we have 20 trainees every year trying to become ophthalmologists thanks to our teaching. We also have master's programs, 2 master's programs. We have postdoctorate programs. We have meetings that we host internationally and nationally. So we like teaching, and this is something that we are proud of, and we do through the institute, the Barraquer Institute. At the Barraquer Institute, we also do research, mainly clinical, but we have a small line of basic research, all eye-related, and it's very successful. We have a lot of publications every year in the international and national journals. And the last pillar is the social work. So we have the foundation, Fundación Barraquer, the foundation that provides, that helps us provide treatment to those people who cannot afford it. Some of the surgeries in the eye are very expensive, especially retina surgeries or cornea transplant surgeries, and a lot of people cannot afford paying for that. Let's not forget that we are a private institution, but we have the social work through the Fundación that allows us to provide these treatments to patients who cannot afford it. in the same way as if they were paying as a private patient. And we are in the past, we also did some expeditions to Africa to do cataract surgery. I was lucky to be part of 3 of them, but now we are focused more on the local needs of our patients. So 80 years later, like Marta said, we decided to move or to establish a second branch, the first branch outside Barcelona, here in Dubai. We have a long-standing tradition of dealing or of treating patients from the GCC area, and we thought that it was a good idea to move a branch here so we could help with the management of patients both in Barcelona and in Dubai. So we opened in October 2021, and before moving here, in Barcelona, we were seeing 30% of the patients coming from the GCC area. So we are experienced in these patients and managing them, and they are happy with us. They already know us here. But I think that one of the traits that we stand up from the rest of the eye centers here is that all our medical team is from Spain, and they are full-time. So we don't, myself and my colleagues are 100% of the time here in Dubai, and that gives us the opportunity to follow up closely with our patients, and patients also feel that we are their doctor. So I think that is something very important, because a lot of times I get this question of, oh, but do you live here in Dubai? And but are you here permanently? And say, yes, I am here permanently. So I think this is one of our strong points. Also, the medical direction comes from Spain. Dr. Musen Saman, he's originally from Syria, but he moved to Valencia when in his 20s to start with the medical school, and he's been living in Spain since then. So I would say that he's Syrian at birth, but Spanish at heart. And Marta knows him, and his experience in the Arab world is very valuable, because he knows the culture, he knows the costumes, and that has helped us all to be able to kind of like settle here easier. And I don't know if you've seen our hospital, if you've driven through Al Hail Road towards Sharjah, I'm pretty sure that you've seen our hospital on the right-hand side in a very desertic area. That is the Dubai Healthcare City Phase 2. We're the first ones to be there. So right now we are kind of like by ourselves, but the area will experience a big development with several hospitals being built around us. So I hope that in the next few years we'll start having some neighbors and we are looking forward to it. So the hospital comprises an area of 13,000 square meters, and we are the first eye care facility in Dubai with inpatients. That means that we can accommodate our patients for overnight stays. And at the moment, we are not using this service for an overnight stay, but we're using this for our patients who require an admission after surgery of a few hours. Most of the surgeries in the eye require only a few minutes of stay, maybe an hour, 2 hours, but some patients require that they have to stay there for like 4, 5, 6 hours. So we have some rooms that are very nice and comfortable for them to stay. We also have the 16 daycare units for patients who have these day surgeries that they have to be in the hospital only for 1 or 2 hours, so they can be comfortable together with their families. I don't know why the presentation is moving on its own. Sorry for that. I'm not a habit trigger. Then we also have a pediatric ophthalmology unit with 2 very nice doctors and with a lot of expertise in pediatric ophthalmology. There are not many places in Dubai with units dedicated only to children. In the eyes, children are not like small adults. Okay, they require specific and specialized treatment, because the things can go much different when we treat when we treat children. And we also have the possibility of treating and managing patients who have lazy eye or squints or any other like congenital or genetic disease. And we also have a dedicated waiting areas for the children to play while they are waiting in the waiting room. We have 4 operating theaters with fully equipped. This is an image of the one that I use for laser surgery with the 2 lasers that we use. And all of them are equipped with the latest technology. In Barcelona, we have this belief or this tradition of getting the latest technology possible to provide our patients with the newest options of treatment and also of diagnosis. So we brought this mentality here in Dubai to be able to treat our patients in the same way that we do in Barcelona. But I think that I like this picture a lot because it's the full ophthalmology team, and this is, I think, our strongest item. Okay, we are all from Spain or trained in Spain. Most of us have been trained in Barraquer, so we know we have the same mentality of treating the patients as we would like to be treated. And only Dr. Alina comes from a different institution in Barcelona, but she's been very fast in getting our motto, because this is the way that she used to treat her patients. So I think that thanks to such a small but big group with different specialties, we can offer you more than 100 treatments for eye-related conditions. And from the cornea, which is the front part of the eye, to the retina, which is the back part of the eye, to the eyelids with inoculoplastics, glaucoma, and other conditions. So I'm going to talk to you about like 3 or 4 conditions that are quite prevalent here in the UAE. We were actually talking about this with Marta before we started the webinar. The first one is dry eye. I'm pretty sure that all of you experience or have experienced at some point in time some dryness in the eyes, more or less symptomatic, more or less severe. There are a lot of factors that contribute to this. One of them is the weather. We are in a very hot country with a lot of dust, a lot of wind, contamination from cars, and this is very, very irritating and very aggressive to the eyes. Also, we have a lifestyle these days of using screens. We are overusing the screens. Okay, we spend 5, 6, 7, 8 hours in front of the screen. What happens while we are in front of the screen is that we don't blink automatically, or the eyes stop blinking, or they blink less. So they get open, they stay open for longer, and that gives dryness, especially if we have air conditioning or fans hitting the eyes directly. So you should always be aware of this whenever you're working on the computer. And one of the tips is, apart from using artificial tears like the ones that we have here, is that you use the 30-30-30 rule. In theory, is like every 30 minutes, you should look for 30 seconds at a distance longer than 30 feet, which is 10 meters. I know that every 30 minutes is impossible. What I recommend my patients is that at least every hour and a half, they kind of like rest their eyes. They go to, I don't know, drink water, to the bathroom, they put some drops, they blink a few times, and then they go back to the computer. Going back to the computer to this is not helping, because this is going to cause you the same problems. So it's good to have these like breaks from time to time, okay, regularly during your working hours, because otherwise you can get very uncomfortable, very annoying eyes with foreign body sensation, irritation, burning, tearing sometimes. People who have very severe dry eye can have like tears falling, and this is because we have 2 types of tears: the ones that form every time we blink, they form a tear film that protect the eyes, and then we have the tears that occur when we have pain or we are sad. So the second mechanism activates in patients who have very severe dry eye to try to in an attempt to protect the eyes. We also have, apart from some of the diagnostic tests that we have, like the Schirmer's test to know the quantity of tears that we produce, we have other machines that can tell us the quality of your tears. So dryness can be because you don't produce enough tears, or because the tears are not good enough, or both. Okay, So based on all the diagnostic tests that we have here and we do here, we can classify the type of dryness that you have and then give you the adequate treatment as per your needs. And that could be like artificial tears with drops, can be in small individual bottles or a big bottle. The most important thing is that they don't have preservatives, because then we can use them every 5 minutes if needed. In very severe dry eyes, we can even like prepare some drops from our own blood. This is blood that we take from the patient. We remove the red cells and we keep the plasma, which is like, it has this like yellowish color. And this has a lot of very good healing properties that help in dry eye. Or we have some, like more recently, some treatments that can help increase the quality of your tears, like IPL. This is basically some light that stimulates certain areas of your face, and that helps the little glands that we have in the eyelids produce better quality of oil, and that gives you a better quality of tears. And this is something that we have also here in Barraquer, Dubai. Then we have diabetic retinopathy, or diabetes in general. Diabetes is a very damaging disease. I'm pretty sure that you are all familiar with worldwide. In the world, the prevalence is about 9%. In the UAE, is almost double. And this is probably because of the lifestyle, the diet, the fact that we are not moving that much. We go everywhere with the car and we are not walking. I mean, you name it. So I found this piece of data very interesting and worrisome. So 6 out of the 10 countries with the highest prevalence of diabetes in the world are from the MENA region. So this is very, very important, because unless you control your blood sugar levels, you can have very, very serious problems, not only in the eyes, but also in the kidneys, in the heart, in other parts of, in the toes, with like necrosis and amputation of the toes. And this is very, very surprising. So it means that here there is a lot of room for improvement. When we talk specifically about the eye, diabetic retinopathy is prevalent in so has a prevalence of 19% in the UAE. This is quite high, especially because patients who do not control the blood sugar levels can have severe damage to the retina that even after treatment can be very can limit the visual acuity significantly. So this is this is why it's so important to do a dilated eye exam periodically. It is more important if you do have diabetes. So at least once a year if the diabetes is under control, or maybe more frequently if the diabetes is not under control, because uncontrolled diabetes can lead to not only to problems in the retina, but also cataract or glaucoma or severe dry eye. Then we have another one that is very important to talk about. I think it's the glaucoma. The glaucoma, we call it the silent thief. Why? Because glaucoma in general is a disease that doesn't give you any symptoms. So it's related to increased pressure in the eye. This is why we are measuring the pressure at every visit, or almost every visit, because if the eye pressure is within normal limits, usually no problem. But if it's above normal limits, you will not feel anything. You will start losing field of vision, like we can see here in some different stages of the glaucoma, until you have tunnel vision. Okay, and you can understand how important or how limiting this can be. Imagine somebody who's driving and has tunnel vision. Without the peripheral vision, let's say that a kid is trying to cross in between two cars, boom, you will not see it until it's right in the middle, so the chances of an accident are much, much higher. So this is why it's very, very important to prevent any damages to the optic nerve. This is a normal optic nerve. The hole in the middle is a normal hole through which the blood vessels come from the back of the eye in the retina. And as you can see here, this is an advanced glaucoma damage in which the hole is too big. Okay, this affects all the cells in the retina, and this is why we get this tunnel vision. So how do we diagnose this? In the old days, we used to have only visual field. Visual field is a machine in which they cover one eye, you look at the center, and they show some lights. If you see the light, you press the button. If you don't see the light, you don't press it. Okay. The problem with this test that we still use because it's very useful is that it only detects damages when it's too late. Okay, it's not. We cannot use it as a preventive diagnosis. We use it as a monitoring tool, especially before and after treatment, but not as a preventive mechanism because it would be too late for us to start. So in the last couple of decades, there were some advancements in the technology, and we use now what we call OCT tomography, similar to the MRI or the CT scan, but without the radiation. And we use some special lights that tell us a lot of information on how healthy the optic nerve is and how healthy the retina is. So this allows us to detect abnormalities or values that are borderline earlier. And we can start with the treatment, if necessary, earlier, because the goal of the treatment for glaucoma is to preserve as much as possible your vision so you don't lose it and you don't reach this point. What are the risk factors for glaucoma? Many. I just wrote here a few of them. Genetics. So if you have a parent that has glaucoma, you have more chances of developing glaucoma. Age is also a risk factor. So after the age of 40, you have more chances of developing glaucoma. Anatomy of the eye. So there are eyes, for example, like hyperops, who are people we call far-sighted people, have shorter eyes, and this kind of like narrows the drainage area in the eye. That can increase or can induce some increased intraocular pressure. Some medications can induce glaucoma. If you read the prospect of every medication, some of them say, do not take this. If you have glaucoma, ask your doctor. And some surgeries can also affect the eyes and produce glaucoma. The last one is cataract. What is cataract? Basically, inside the eye, we have one lens, the one that we were talking about earlier. Okay, this lens is transparent when we are young, when we are kids. And as we age, it will become less transparent. It will kind of like become foggy, or it will change in color. You can see here, this would be a normal clear lens, and how it progresses in color, first yellow, then brown, and finally black as the cataract progresses. We can have also some what we call white cataracts. This can be produced either because of age or because of trauma. Maybe you had a hit when you were a child in the eye, and then years later, the cataract forms. So what are the main symptoms? Basically, think about it as the windshield in your car, when after like one of these like wonderful muddy rains that we have, it will become completely dirty, no? So that affects our vision. It can give us blurred vision. It can give us light sensitivity. It will give us fading of colors. So colors will look like paler with the cataract. Sometimes it can give us double vision, especially if the cataract affects only the center of the lens. It will give us difficulty in vision. Why? Because less light comes in, so the contrast sensitivity is less. So at night, contrast sensitivity is less in all of us. That's why we say that at night, in Spanish, we have a saying that says, at night, all the cats are brown, meaning that we don't have enough light for us to distinguish between different shades of the same color, for example. And then also people experience need for bright lights when reading. What is the solution for cataract surgery? Okay, and what do? We basically replace this lens. This lens, like I told you, is like a lentil. It has a skin and a core. We make a hole here, a small hole in the center. We remove the core. We keep the rest of the lens. We call it the bag. And inside that bag, we place another lens. And based on the features of the patient, based on the characteristics, based on the needs, we can place a lens that is only for far, for example, and then we need glasses for reading, or lenses that are for all the distances. This reduces the need or the dependence to glasses for all the distances. It's not perfect vision yet, but lenses these days are getting much, much better. And now we can have very, very good results with almost 100% independence to glasses in selected cases. What happens when we age? This is something that I think it's important to discuss about. So there are normal changes in vision with age. One of them, for example, is cataract. The lens becomes less clear, and that affects our vision. many of the changes that are common can be corrected either with glasses or with other like contact lenses, or maybe with surgeries. But we have to be aware that some of this vision can affect our everyday activities. And this is especially important because as we age, our independence in like moving around, in like reflexes, the response to some in some situations are much lower. So if the vision is not good, we can have accidents. Elderly people can fall, break their hips, and that can reduce the life expectancy significantly. So it is very, very important to address these issues when they appear or as they appear. And the most common ones are difficulty in focusing. I'm pretty sure that whoever is 40, 45 years old has started experiencing that without glasses, reading is more difficult. We have to put things further away. We have to increase the size of the letters in the mobile phone. This is called presbyopia. This is a normal change that happens with age, around the age of 42 to 45. And this is normal and can be very annoying, but it's normal. And for that, we can use glasses. We can use some types of surgery, sometimes in certain cases, but this is not a disease. This is basically the normal process of aging, like wrinkles or like other changes. If we develop some cataract, we start decreasing, our contrast sensitivity is going to start decreasing, and we will need more light to see things clearly, okay? Everybody experiences these changes, but some people, they don't notice the changes. For example, difficulty in focus for reading. If you are short-sighted, a lot of people, short-sighted people cannot see well for far, but they can see very well for near. So what they do is they remove their glasses and they can see very, very well, very sharp, okay? So they may not notice that they have difficulty in reading because they basically use the glasses, they take the glasses off or whatever. Or, for example, there are some cases in which the cataract progresses very slowly and you get used to the changes, so you don't realize until you come to us and we tell you, no, your vision is 40%, 30%. And then when you do the surgery, you realize how bad your vision was before and how good it is right now after the surgery. So, but that doesn't mean that you don't develop these changes. Like I said, many changes can be corrected. The most common ones can be corrected with glasses, contact lenses, improving the lining for reading, or even some types of surgery, either through laser, depending on the age, or through a lens, either with or without removing your own natural lens. What are the changes that we should not consider normal? So anything that affects your vision and that cannot be corrected by standard glasses, lenses, medication, or surgery. So one of them, age-related macular degeneration. This is a disease that affects elderly people and that affects the center of the retina, which is the area that gives us the sharpest vision, okay? And these people kind of like have this type of vision in which they see around, but they cannot see in the center. So they tell you, oh, I cannot see the faces of people clearly. I see kind of like a shadow or a dark spot in the center, and it's always there. These are, especially in an elderly patient, you should always think about age-related macular degeneration. Another one is cataract. We've discussed about it extensively, the blurry vision that the cataract can give you. Diabetic retinopathy, depending on the area of the retina that is affected, can give you these patched black or blind spots. And glaucoma, the tunnel vision, or in absolute glaucoma cases, no vision at all. So basically patients who are have been affected by glaucoma severely, they cannot see even the light, okay? And dry eye with all the symptoms that it can give us, as we had discussed before. So the problem is that some of these diseases have no warning signs. For example, glaucoma, okay? I don't feel anything until it's too late. So this is why early detection and treatment is key to prevent and to preserve your vision as much as possible. And this is why, especially after the age of 40, we should all go to the eye doctor at least once a year if we are healthy, or once every 2 years maximum, for a comprehensive dilated eye exam. In certain conditions, the frequency should be less, should be every few months. In children, every child should have a comprehensive eye exam at least at the age of 3 years old, more or less, unless you notice something before that. But if the child is apparently healthy at the age of 3 or 4 is when we recommend that they visit us at least for the first assessment. But yeah, after the age of 40, you should see us at least once a year to make sure that everything is fine. How do we do a comprehensive dilated exam? Basically, we check your vision, the refraction, which is the numbers that you get for the glasses. We check the intraocular pressure, like we explained before. This is me, for example, having an eye check on my father before I moved here back in 2020. And you can see here that I'm checking the front part of his eye. I did the intraocular pressure. This is the machine that I was talking to you about, the slit lamp. And this is a kind of like a microscope, a modified microscope that allows us to see all the details of the eye. Then we have to put drops to dilate the pupils and check the retina if possible. In some cases, it may not be possible. So we have other like special scans and pictures for that. We have a lot of tests. So based on the symptoms, based on the findings, we can perform different types of tests to confirm certain diagnoses or to rule out complications or other conditions that need to be treated. And here in Dubai, we have a very extensive group of equipment, following also like our the way that we do things in Barcelona, for us to be able to diagnose most of the conditions in the eye, from the front part of the eye, the eyelids, to all the way to the back, and even sometimes further back in some neurological conditions. And like I said, it is in healthy people, at least once a year, you should get these comprehensive eye exams. Last slide, and I think that it's going to be better for us to start like with the questions and answers. But the last slide, general recommendation for healthy eyes. Some of them are common to general health, okay? Like smoke. Smoking makes us age and affects the eyes, can give you cataract earlier, can give you retina problems, can give you skin problems with less elasticity. So you can have like the baggy eyelids that look like that people do surgery for. So smoking is not good. You should always eat a healthy diet, especially rich in vegetables, fruits, and fish. Fish provide you with omega-3s and 6, which are very healthy for the retina. Vegetables and fruits provide you with a lot of what we call carotenoids and vitamins, which are basically pigmented, some molecules that help the cells in the retina to stay healthy and to become healthy. You should be physically active. This is not only for the eyes, but for the rest of the body. But if you are physically active, and that by that I mean you could just walk for an hour, like a brisk walk for an hour, burns enough calories and keeps you active enough, or even like 30 minutes. You don't have to like weight like 120 kilos, okay? You just can walk or go to the gym or things like that. This will help also with all the blood flow to all the organs and also the eyes. And treat and control your blood pressure, your sugar levels, anything that could affect your health in general and that could affect the eyes. Here, I'm surprised because in Europe it's not such a big deal, but it seems that here people are kind of like allergic to sunglasses. Especially local people. Sunglasses are very, very, very helpful, especially in countries like ours, with the sun exposure that is so strong and so intense. They protect our eyes not only from the wind or from the dust, but also from the sunlight, from the sun rays. And the sun rays can affect, can induce dryness, can give you cataract, can affect the retina, okay, and can also like cause conditions like pterygium. Pterygium, we have this, the conjunctiva is the membrane that protects or that covers the white part of the eyes. In normal conditions, it does not cover the cornea, which is the transparent part in the center, okay? In the sun can induce some changes, mostly in the inner corner, that make that this conjunctiva starts growing over the cornea, and this is called pterygium. And this needs to be removed surgically, because if it progresses, it can block your vision completely. It's not a dangerous thing, but it's something that with sunglasses we can prevent very easily, and also in children. During summertime, we do a lot of like do-it-yourself work, or we decide to paint the apartment, or use do some cleaning. Every time that we use some hazardous materials, we should use eyewear protection, because I've seen a lot of silly, quote unquote, accidents happen with devastating results for the eyes. So a chemical injury, let's say you're washing the toilet or the floor, and some of liquid goes in the eye, that can be very, very, very damaging to the eye. I've seen very severe chemical burns in the past. Thankfully, not here in the UAE. Let's knock on wood, not yet. But this can be very, very limiting, and you need to do a lot of surgeries. It's very, very dangerous. So it's very, very important to use the adequate protective eyewear when we manipulate any hazardous materials. And the last thing, like I said before, we are in a country in which we have a lot of dust, a lot of wind, a lot of heat, and that irritates our eyes. And the first thing that we do, boom, 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 we rub the eyes. It feels good. I know, it does feel good, right? It's not good at all. It's the worst that you can do to your eyes, okay? If you go to YouTube and you just type rubbing eyes MRI, you will see a nice video, black and white, so no eyes, no nothing. So for those of you who are a little bit apprehensive, no worries. It's a video that you can watch on what the eye looks when somebody is rubbing the eyes. And it's amazing. I mean, the compression of the eye, how things touch, like the cornea touches the back of the eye, your crystalline lens, and so on, so on, so on. It's incredible. So it's the worst that you can do to your eyes. And if you rub your eyes, especially in children, you can develop conditions like keratoconus, which is that the cornea, instead of being round like a ball, it becomes like a cone. This affects your vision, and it needs to be treated with some surgeries. And in very, 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 very advanced cases, you need to have a cornea transplant. So it is very important, especially for those of you who have kids, that you tell your kids not to rub their eyes. You can use as many lubricants as you need to, and if they have any other conditions like redness or itchiness or some allergies, the best thing to do is to have us have a proper examination and give them the proper treatment. All right, so thank you for the attention. I hope that was not too much, but now I'm happy to reply to any questions you may have.
Thank you, Borja. Now we are waiting if someone wants to ask something. Just you have the Q&A click here under the screen, and you can ask the doctor whatever you need to clarify. I think it was amazing, you know, all the information, so maybe they are not going to need to ask anything.
I hope I was not too fast. I tried to kind of like synthesize some of the basic things for you to know, no, as a general eye health, and also to introduce us to you, because some of you may know us from Barcelona, but some of you may not. And just to kind of like introduce us to you and say that we're here in case you need us. I hope that if you need us, it's something not important. I wish you the best health, but in case you need us for something else, I'm happy to be here. We are happy to help you. Okay, first one.
We have two. The first one in Spanish. ¿Puedes, por favor, explicar el procedimiento estándar para una operación de miopía?
Yes, I'm going to start with this one. So for they're asking me if I can explain the standard procedure for myopia surgery. So standard procedure, you come, you do refraction. Basically, we need to know how much myopia you have, because we cannot treat any grades of myopia with laser. So let's assume that you have like -4, -3, -2. Okay. Then we do also a test to check that the cornea is healthy enough for us to do the surgery. And then if that is the case, you come one day, do a number of tests to make sure that yes, everything is healthy, and then the surgery. The surgery we do it only with drops, anesthesia drops. The most common technique is LASIK. In LASIK, we use a laser to kind of like create like a flap, like a cut in the cornea. We open the cornea like a book, and then we do the treatment with a laser, and then we put the cornea back. This is quite, the recovery is quite fast in terms of vision and discomfort. But we also have another technique which is called PRK. In PRK, we scrape the surface of the eye, the skin, let's say, and then we use the same laser to treat, and then we put a contact lens for a few days, the skin grows back, and then the vision starts becoming clearer and clearer. This one is also very safe. The only disadvantage, or the main disadvantage, is that it's a little bit painful the first couple of days, and the recovery of vision is it takes a little bit longer. The last one would be SMILE. In SMILE, we use a different type of laser to create kind of like a little lens within the cornea, and we remove that lens. And that gives you good vision as well. The recovery is kind of like in between the LASIK and the PRK, but the three techniques, if the selection of the patient and the eye is healthy, they are very, very successful. In cases that we cannot do laser surgery, we can implant a lens inside the eye without removing anything. Okay, let's say that you have -8 or -9. We cannot do laser. So in those cases, we implant the lens. This is a different procedure. We do one eye first, 1 week later, we do the other eye. The recovery is usually also quite fast, and with some special limitations and some things that you can or you cannot do. But this would be the 4 most common techniques for myopia. So I hope that I responded to your question. Okay, rubbering eyes. I do much wrong. Don't do it. How can I stop that? I have oily eyes, but also dry. Okay, so that is very. I know it's difficult because it's a habit most of the times. The most important thing, you cannot rub your eyes, because otherwise you will get into trouble. You will have to come and see me, and we'll have to do something to correct or to treat that. Every time you have dryness, itchiness, whatever, you need to use drops. Okay, so the drops should be your best friend, and you should have them readily available anywhere. One of the things that I also tell my patients is that they should tell their relatives to kind of like monitor them, because sometimes people rub their eyes inadvertently. So if we have somebody who's kind of like picking on us, saying, okay, don't rub your eyes, use the drops or whatever, that also helps. If the artificial tears are not enough, then you should come and see us, because maybe you have to use other types of treatment, because you may have a little bit of inflammation, or you may have an allergy, and sometimes the artificial tears are not enough, so we have to treat those, because otherwise you will continue rubbing the eyes. But it's very, very important that you don't rub your eyes. And also protect your eyes from whenever you're outside, sunglasses, wind, dust, anything that can cover your eyes will give you less dryness. Next one is in Spanish. How does the surgeries work with private insurance? Are all included? I think we have almost all of them. I don't know about the details on that. Okay, but we have for sure the most of the biggest insurances here in the UAE. We are finishing a couple of deals, hopefully in the next few weeks, for a couple of 2 also big ones. As far as I know, my patients, if the insurance doesn't cover the visit, they pay for the visit and then they ask for reimbursement. And we help them with the process. I have to do whatever paperwork I have to do, and that usually works. There are certain things for surgeries. For example, let's say that you have cataract and you want to have multifocal lens, the lens that can allow you to see at all distances. There is no insurance that covers for that type of lens, because they consider it aesthetics. We could debate about that. I don't agree with that, but this is the way that they work, and they cover usually for the surgery, but they don't cover for the lens, and the lens is usually covered by the patient. Can recommend glasses for the blue light of screens? Good question. at the beginning, it looked like they were like the best thing you could do, and so and so. There is no evidence, okay? There is no evidence whether they work or they don't work. What I tell my patients is that if they feel comfortable, they feel less fatigue, because it's true that they kind of like help with the strain of being in front of the computer, okay? Use them. It's not going to harm you. My boys, they are 10 and 12. They are absolutely healthy so far, and but we use the blue light glasses whenever they need to use the iPad or they need to use the computer. I think it helps, but it's very patient related to patient dependent. So some patients don't feel anything, some patients do feel better. The most important thing, like I said, is that they don't damage your eyes. Worst case scenario, you will have to spend a few dirhams for something that, okay, you feel the same. But if you feel like you want to try it, go ahead and do it, okay? Is glaucoma hereditary? If glaucoma is hereditary, what precautions one can do to avoid it? To avoid it, unfortunately, there's no genetic treatment yet, okay? But to prevent the damage from it, definitely you can do something, which is go to your eye doctor for an eye check. If everything is fine, everything is healthy, the pressure is normal between 10 and 21, they will probably tell you, come back in 1 year, okay? And do regular checks. But like I said before, if you do have any abnormalities or any suspicious features, then we have to do some tests to make sure that you are still healthy, that you do not have glaucoma. But if you have your father, your mother, your sibling, if they have glaucoma, you need to be checked for sure. And depending on what we find, we will check you more or less frequently. Okay. Next, for cases in which eye pressure must be checked regularly and it's difficult to go to the clinic every couple of days, do you recommend using other measures, portable devices? This is something that we have always tried to get or to achieve in ophthalmology, and during COVID times became like a hot topic. There are some portable devices available. I'm not familiar on the efficacy, efficiency, and all this, okay? Why? Because even with here, for example, we have 1, 2, 3, like 4 or 5 different devices to measure the pressure, okay? There is one that is the gold standard, which is the one that I showed the picture of, which is a little cone that you kind of like touch very gently the cornea and you measure the pressure. That would give you the best reading. The other ones are very, very good, but sometimes they have like readings that can be high or low. For example, if I'm holding your eyelids like this to measure the pressure and I put some pressure on the eye, the pressure will be high, okay? So portable devices can be useful the same way that blood pressure portable devices can be useful, but you should always double check with an eye doctor. Okay, so for example, I'm pretty sure that you've been to a place where they did the puff of air. Okay, the puff of air gives you falsely high readings because when the puff goes, you blink, you squeeze your eyes. So if let's say that you have one of these portable devices and your pressure is 24, I would ask for an eye doctor to see you to double check and to make sure that this pressure is not abnormal for you. I'm not going to go into details, but sometimes 24 for one patient is not high, and sometimes 16 for a patient is high. Okay, and this is what we need to check what we do check when you come to our clinics. Can presbyopia be treated with surgery? Yes, we have some options. They are not good for everybody, unfortunately. There is a range of age right now that is kind of like left alone in terms of like correcting your vision. So the age between 42 to 48, 49, in these patients, LASIK may not be an option. There's a treatment that we have here in the hospital that's called Press Beyond, which we do with laser. We need to do some tests before that to see if you're suitable for that. And it's doing some special LASIK treatment. Sometimes we can implant also, we have them available, some lenses, multifocal lenses, without removing anything. But it's true that for presbyopic patients, the options these days are not as, they are a little bit more limited because of different, because you have two issues. You have the issue of vision for far and the issue of vision for near, which are not good, okay? So I would say that it's based on every individual and every patient. But yes, we do have some surgeries that can treat presbyopia. Thank you, Anna, for the, she's thanking me for the presentation. So I'm glad that you liked it. Thank you very much. And next, what is normal pressure eye range? Okay, so normal pressure eye range should be between 10 and 21 for the majority of us. Anything lower than 10 could be a sign of problems in the eye. So there's some conditions in which the eye, so the pressure in the eye comes from a liquid that forms behind the color part of the eye and that fills the front part of the eye, okay? So that is what we call the aqueous humor. The liquid is formed all the time, non-stop, and then it drains in a certain area of the eye, okay? So this is constant, and this keeps the eye at a certain pressure, like the pressure in the tires of your car, okay? Normal range is 10 to 21. If the pressure is too low, it could be because that the eye, because of inflammation or something, is not producing any liquid or not producing enough liquid. And that can give you problems in the back of the eye. If the pressure is too high, then it can lead to glaucoma. Like I said, in some patients, pressures that are a little bit higher than 21 can be normal. And in some patients, that pressures that are like between 10 and 21 can be abnormal. So this is why we should check the pressure and other parts of your eye regularly to make sure that the pressure is not damaging your eye. And thank you. The last comment is also thank you. Thank you very much, all of you, because I'm pleased with all these questions, and I hope that I could at least explain some of them. But if you have any more questions or any comments, you have my my email in the presentation, okay? Please feel free to send me an email and I will try to respond.
We will upload all the webinar in our YouTube channel. So they will have all the information for, you know, in any case that anyone wants to watch again or to have all the information clear in 1 hour. It is very useful. Thank you so much, Borja, and thank you for all the attendees, all the people who make, you know, these kind of events possible, and hope that you are going to have a good week and a great day today. So thank you.
Thank you very much for the invitation. It was a pleasure, and I had fun. The problem is that I like the interaction, but it's okay. This is what Zoom.
But you can come to our monthly breakfast. Tomorrow we have one. Maybe you have to, you know.
Yeah. I will talk to Dr. Saman, and hopefully the next time I can join him.
Okay, great. Thank you, Borja. Bye.
Thank you. Have a good day.